and welcome to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation focused on youth mental health. Before we begin today's episode, I just wanted to let you all know that all content that is found in our podcast is created for informational purposes only. This content is not intended to be a substitute for professional medical advice, diagnosis, treatment, or therapy. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition, and never disregard professional medical advice or delay in seeking it because of something you have heard in this podcast. Thank you so much, and without further ado, let's get started.
Hello, everyone. Welcome back to another episode of Mindful, Beautiful, and Thriving. It is your host Poonam here with a very special guest, Sampath Bananda. Today, we are going to talk about mental health and why it is important to be aware of your mental health and what to do in times of need. Welcome, Sampath. It's very exciting you're joining us today. And you're joining us from India. That's make it double exciting. So I'm looking forward to talking to you. Before I ask a few questions, I would request you to introduce yourself and tell us more about you and what you are doing currently.
Hi Poonam, I'm Sampath, based in Bangalore. I'm working as a business development manager for Cisco Professional Services team. We enable sales team to sell more Cisco services products. I'm basically from a remote village in Kodagu district of Karnataka and currently living in Bangalore with my wife Gayatri and 14 years old son Shashank. Speaking about my professional career, I started my journey with HP almost 14 years ago and then joined Cisco in the year 2006 and working in various capacities starting from business analysis to project management, service management to incident management, and from past 1 year I'm working as BDM for EMEA services team whereby we help the sales team to position best of our Cisco services to their customers. As pre-sales business operations manager, I'm responsible to understand customer requirements, put across a proposal, work with the architecture medium to arrive at efforts required, bid managing RFX, orchestrate with SMEs, build a cost model, put across a commercial proposal, and prepare contractual legal documents which are SAU. And also in addition to that, partner management and customer negotiations for Cisco Professional Services.
Thank you so much for introducing. It's wonderful to know you're a working professional, a loving father, and a husband. So, uh, my first question to you is what is mental health in your perspective?
So according to World Health Organization or simply WHO, mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stress of life, can work productively, and is able to make a contribution to his or her community. Mental health includes our emotional, psychological, and social well being. It affects how we think, feel, and act. It also helps in determining how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood to adolescence and through adulthood.
Thank you, Sampath, for sharing a detailed definition from WHO, and I fully agree. It's the state of well-being. If we ask ourselves, am I well? Right? My being is well or not? And you mentioned, many aspects of life. It's not only, You need to have physical health, you need to have that emotional, psychological, and as well as social. And another good point I liked is mental health is not only important to adults or working professionals like us. So it's very important at the every stage of life. Like all of us want to be physically also active, healthy, and the same is true for our mental health. So thank you so much for sharing that definition. So my next question to you is, have you had any challenges in your life where you felt overwhelmed and maybe your mental health was not that well as you wanted to have?
Yes, I had many challenges in my life. It was in many forms. It affected my personal life as well as professional life. When I was in this phase of mental health, I used to get angry at everything. Each and everything, I used to act differently. I used to spend unnecessarily. Later understood it as a frustrated shopping, and how we dealt with it. It is a proper counseling with a psychological doctor. I could speak about it openly, unlike many who still don't feel like speaking about it. In our country, we have a stigma about speaking about mental illness with anyone, even with the experts who can help us to get it resolved. But we tend not to speak about it. Glad that I did not have that stigma, and at my early stages itself, I could come out of the stigma and speak about it openly. Only then one person will be able to help to fix the issues that we have with regards to mental health. And I am of the opinion that the only person who definitely knows everything about your mental health situation is you. And unless you speak about it, nobody can help.
Wow, thank you so much for sharing your story. And as I understand, anger is a secondary emotion, not the primary. But I'm super glad you understood something was not right with you and you reached out for help. And you're absolutely right. We are having so much stigma about our mental health. We don't have that for physical health, right? Even though physical health, we do not go to doctor, but we go to some medication over the counter. We take it. We want to feel better. I'm glad it worked out great for you. So, did pandemic had any impact on your well-being or added to any of the problems you just shared?
Yes, pandemic had a greater impact on our well-being. I feel during the 12 months of being a remote or indoors really had a great impact on the well-being of everyone. We humans are social beings, and with social distancing, our social being has really had a great impact, and it constituted in many ways to impact our daily life.
Yes, I agree. And as we said, well-being is important from all aspects, like emotional, psychological, and social. And when we are not able to meet with our loved ones and we are contained in that four walls of your home, definitely, I also felt that impact. And, I love nature and nature nurtures you, so that was definitely difficult time for it, not only for us, and it was difficult for all around the world. That was amazing in event I think we all experienced in our lifetime. So we had a lot of learning from that. So how did do you take care of your emotional, psychological, and social well-being? Now we know, like, we can meet with our family, friends, and things are getting, I would not say normal, back to normal, because that it will never go back to the state where we were pre-pandemic, but at least we are able to meet with our friends, family, and definitely things have gotten better. But how do you now take care of your emotional, psychological, and social well being?
So, with regards to emotional, psychological, and social well being, I think for me, meditation and medication, those are the key elements which help me. Meditation can be of any forms. I don't say it needs to be done in one particular form, but there should be some time given by each individual for their self control. And what I follow is a healing therapy in which I thank myself and I thank everybody who helped me on that particular day. For example, I start with a small prayer in which I just say thank you and thank you. Continue thanking everyone one by one. Although I am not very regular into physical exercises, but I try to involve myself whenever possible on some or the other forms to burn the fat. For social well-being, I belong to the community and interact with the children from various schools during my CSR initiatives. I love giving back to society in whatever possible ways, and Cisco supports very much through volunteering, group volunteering, time to give, and matching grants program. And I have been lucky to be part of so many NGOs to support children in their educational needs. I start my day with a promise not to worry, not to get angry, to be honest, love everything and love everyone and respect every deed.
Wow, Sampath, that's amazing. When you were sharing that therapy and that attitude of gratitude, how you start your day, I felt myself that goodness. So I'm sure by practicing that, you're feeling great. That's the reason you're sharing that. Very simple, right? We can overlook and take these things for granted, but having that attitude of gratitude is so important and healing to yourself. And I really loved your other thing you said, take control of your emotions. End of the day, it's your emotion. You own it. Yeah, there could be surroundings, very stressful and all, but can I take a pause and take control of myself? So, other thing, what you said, giving back, be part of something bigger than you, right? Because I am getting so much from others, but what am I doing for others, right? Life is not all about work, work, work. So, it's very important for all of us to take a pause and get involved ourselves with something bigger. Like I am part of this Tadika Foundation for the same reason, because I learned a lot in this my journey, life journey, and I do feel it's a good idea for me to share my learnings with others as you are doing. So thank you so much for sharing that with us. So we understood you take care of yourself in various ways, and you mentioned about medication also. So anything else you would like to share you do to take care of yourself?
So, explaining about what I did to take care of myself, I had a good support system. Believe me, I think it is one of the best. I could share anything with the support system and they would help me to come out of it. Experienced medical professional and medication is the key to control the mood swings and anxiety. I had a great doctor support from Narayana Healthcare, Bangalore, and counseling to bring back to my normal state was a great choice. My family, starting from my wife Shayla, my son Shashank, and my parents, in-laws, brother-in-law, everybody contributed to the core. I also followed an approach called as AAA approach: accept, adjust, and avoid. AAA approach really helps us in everything. You are the best judge to react to any situation. So I never used to follow this before. Pause, think, and act was the best approach on every thought that comes to my mind. Pause, think, and act, which means do not immediately react and
Thank you,
act.
Sampath. Again, wonderful advices, the importance of support network. And I will tell you from my personal life experience. When I was new to this country, I did not have that support network, and I went through a lot of emotional and psychological challenges myself. So I realized the importance of that support system, and I'm super happy I have a large support system. So for those listeners who do not have a support system, what worked for me was writing down my own emotions to, like, feel better. Because if you do not have listening ears and your loved ones are very far away, you do not know how to take care. Just simply take a pen and paper and start writing down, and it did wonders to me. I started with that high emotions, negative mindset, and after writing down slowly all my emotions were calmed down, and I felt better. That worked out great. And I really loved your AAA approach, right? There is a huge power in acceptance. I always ask, whenever a situation comes in front of me, I always ask, do I have a solution for it? If I have it, I will go for it. I do not even need to worry. But if I do not have a solution and things are beyond my control, so what can I do? I just accept it. And as you mentioned, adjust. And if things are not that powerful enough to face it, okay, I will avoid for the time being and come back to it later on. And the third tip, you mentioned the power of pause. That's amazing. And I think we all can develop that muscle of not immediately reacting, but taking a pause, thinking about it, and then acting. So that's wonderful advices you gave to us. So how do you make time for your well-being as a busy working professional? Because people all the time say, "Hey, I do not have time." You know, I feel, to be honest, like everybody has 24 hours in a day, right? People who are taking good care of themselves, they are also having 24 hours. So in my mind, having like more time will not really make you a better your well-being will be better. So what do you do? Like, how do you make time for your own well-being?
And how I've made time for well-being as a busy working professional. Yes, really, it is a difficult question to answer. Due to psychologist's medication, I tend to get more sleep. I'm taking lots of medication with regards to my diabetic as well as the psychiatric. I sleep more than 10 hours a day. And talking about my feelings openly, exercising regularly, practice mindfulness, eating healthy, and getting enough sleep are just of some of the steps to take good care about my well-being. Thank you. Thank you very much.
That's wonderful, Sampath. And as we are saying, make it a priority. Make time for yourself. As we say, health is wealth. Money will come and go, but once health is gone, it's very hard to regain to that state. So thank you so much for sharing your experiences, being honest and open with us. I am very inspired to listen to your story, and the courage you had to share your feelings honestly and openly with your family, and taking that support is really inspiring to me. So my request to all my audience, no matter what, never ever bottle up your emotions. As we discussed during this podcast, if you do have a support system, wonderful, take advantage of that support system. But if you are not having that support system, empower yourself. Like I mentioned, how I used to take care of my emotional health when I did not have that new, I did not have that support system because I was new to this country. So, and other, things what Sampath shared, right? Practicing mindfulness, taking care of your body by feeding healthy food, exercising, these, and having good enough sleep, because during sleep we regenerate our body, right? Our mind as well. So, and these things, meditation, it's free. You do not really need to spend money. There are so many apps. So let's take charge of our own well-being, not only physical health, but mental, emotional, and psychological. And as Sampath shared, these are the easy to do things. We all can be happier and healthier if we just follow the simple steps. So thank you so much, Sampath, for joining us today. I'm very grateful to you, and I learned a lot. I love that therapy what you shared. Be grateful for everything you have. Starting your day with that attitude of gratitude and ending your day with attitude of gratitude will make your life much happier and easier. Thank you so much for joining us today.
You're welcome. And one last note, the only person who would get to know about your mental health is you. So you have to take care of yourself.
Awesome advice, Sampath. Yeah, you need to be on the driver's seat and take good care of yourself. I hope all of us will take good care of ourselves. Thank you so much again.
You're welcome.
You are listening to Mindful, Beautiful, and Thriving, a podcast series by Tharaka Foundation. As part of our youth series, we will be releasing new episodes every Friday, so make sure to continue to check those out. We hope you enjoyed this podcast, and thank you so much for listening.